We want to thank you for joining us today for this webinar. We are with Cornerstone Retirement Partners, and we are going to be discussing the comparison of Medigap plans versus Medicare Advantage plans. Our goal today is to help you decide whether a Medigap plan is the right thing for you or an Advantage plan. Just to be clear, we are not going to talk about specific carriers today. We will just be presenting material for educational reasons only. This is our team, the Cornerstone Retirement Partners Health Insurance Made Simple team. Many of you know Nancy. Kristen Rushlow is joining me today, and the three of us are all health insurance advisors. We are all available here, so if one of us happens to be out of the office, you have the others available. If you have any questions or concerns, our team is always here to help. A couple other members of our team, Becca, she is our client services coordinator, and she actually recently earned her life and health license, so that she's able to assist you too. Many of you talk to her on the phone when you call to make an appointment or have a question. So this allows you to put a face with a name. Sherry is Nancy's sister. She also helps us part-time with a lot of administrative duties to help keep our team running smoothly. This chart should look pretty familiar to you if you've worked with our firm. We always review this chart when we sit down with you for our initial meeting. It just lays the foundation to let you know what your options are. Everyone has A and B, that's the foundation, Medicare A and B, original Medicare. But if you go down the left side of the chart, some of you have a Medigap policy and a standalone prescription drug plan. Others of you are on the right-hand side with a Medicare Advantage plan that wraps your A and your B and your D all together. As we go through this webinar, I just encourage you to think about why you picked the side you did when you first came aboard. Why did you pick the Medigap, or why did you pick the Medicare Advantage plan? And then just also kind of think about where you are now, and does that make any changes in where you're thinking you should be moving forward? Medigap plans, they're also sometimes called Medicare supplements. They are issued by private insurance companies. They have standard plan letters like G or N or F, not to be confused with the parts A and B. These are plans, not parts. These plans pay secondary to Medicare. That simply means that when you go to the doctor sends Medicare the bill first. Medicare does what it's going to and pays what it's going to, and then passes it on to the Medicare supplement or the Medigap company. Depending on what plan you have, that company will look to see if you've satisfied your Part B deductible. If you have, then they will pay that. If they haven't, they'll pass the bill along to you. These plans, you can think of them as paying up front for having virtually all of your out-of-pocket expenses covered for parts A and B. When you first came aboard Medicare, and joined a Medicare supplement plan, you had what was called guarantee issue. That simply means that there's no medical underwriting and they don't ask you any health questions. There's no pre-existing conditions. That is true again when you first come aboard. The premiums for these plans are in the neighborhood of $110 to $125 a month when you come aboard at age 65. Been on your plan for a while, you know that price has probably gone up. They do have yearly rate increases, and those are based on your age and your zip code. And COLA here stands for cost of living adjustment. So all those things are taken into account when they adjust your rates every year. Again, think of these as paying up front for comprehensive coverage. They are guaranteed renewable, so they are not subject to the annual enrollment period that's coming up. You can hang on to these plans as long as you're paying your premium. If for some reason that premium is getting to be too high, we do offer something called a revisit, where we can take a look and see if we can lower your rate. The key is that you will be subject to medical underwriting when you go to revisit. So that guarantee issue, you already used up your one shot at that. So they will look at your medical history. They'll look at the prescriptions you take, and they'll determine whether they're able to issue you a new plan or not with a lower rate. So these are some changes that we're expecting for Medigaps moving forward. So the loss ratio for Medigap plans is at an all-time high. What does that mean? It simply means that when you compare what they're having to pay out in claims to what they're taking in, that margin is shrinking. So it's something that each Medigap company is going to take a look at to confirm that they are staying solvent, and that they're always going to be there to pay your claims. Healthcare costs, as we all know, continue to rise. One reason, by the way, for that Medigap loss ratio going up is actually COVID, because so many people put off their preventative care during COVID, and now they're getting back into the swing of things, and they're being diagnosed with more serious issues simply because they had put off that preventative care for a couple years. So they're having to have more serious things dealt with. And a lot of the elective surgeries, maybe a knee replacement or a hip replacement, people put those off as well, and now they're starting to get those things done. So there's a lot of costs being incurred by the insurance carriers at this point. Also, from 2018 to 2023, they really didn't change that initial rate. That rate when you first come aboard Medicare only went up by about 2.6%. Understandably, if you have been in a Medicare Medigap plan for a while, your increases were probably higher than 2.6%, but their base rate really hasn't gone up much. Most of the large carriers sell Medigap plans, but they also sell prescription drug plans and Advantage plans. And we'll get into some of the changes that are coming down the pike later in this webinar, but there's going to be some costs incurred by the insurance carriers that they may kind of spread not only in their Part D, their Medicare Advantage, but it might also spill over into their Medigap plans as well. So as a result, we expect Medigap premiums will increase more than they have in the past. And maybe that increase could be like 10 to 15% over the next few years.
Now we're going to talk about Medicare Advantage plans and what are the differences than what Amy just spoke to. So Medicare Advantage plans are also referred to as Part C. Many of you have maybe heard. There's a lot of stuff on the TV right now about this, and basically what it does is it's combining Part A and B, and now we have Part C, or a Medicare Advantage plan. So either name. These are private health plans that pay instead of Medicare, so they're managed care plans. They cover everything that original Medicare covers, plus some more additional items, and I'm going to speak more to that here in a few slides. These plans do have deductibles, co-payments, possibly co-insurances. All of those could apply to your Medicare Advantage plan. And then also it depends on where you live, where the plan service area is, because not every plan is available everywhere. Which brings me to this next slide. Your monthly premium also is going to be based on your service area. What zip code and county do you live in will determine what region that you are within the plan. Many of the Medicare Advantage plans do have a $0 monthly premium. If it's not zero, then they might have some kind of premium, but they are much lower than the Medigap policies. You, of course, still have to remember, you're still always paying for that Part B premium. And then in addition to whatever your plan premium is for the Medicare Advantage plan. These plans differ from Medigap's because they are network choices. So they're choices of a PPO, an HMO POS or HMO. A PPO is a preferred provider organization. The HMO, health maintenance organization, with the POS as the point of service. And just kind of to a quick differentiation between the two of those is the PPO gives you more flexibility to go in and out of network. Where you go out of network, you might pay still the in-network payments. And then the HMO with the POS portion attached to it, that gives you, again, more flexibility to go in and out of network, but you just have to be aware that you might have to pay more if you do go out of network. So these are network driven. So those in and out of network conditions do apply. So what we do when we sit down with clients to make sure that, hey, do all of your providers participate with this network? We're only going to show you carriers that everyone is in network. And then they also have something called a maximum out of pocket, which of course it varies by plan. But the maximum out of pocket is something that you are slowly chipping away at over the course of the year. It is not to be confused with a deductible, so you don't have to satisfy that maximum out of pocket for the plan to come in and start paying for services. So these plans do change annually. So we're entering our busiest time of the year here pretty soon, and that is called the annual enrollment period, or AEP is what you might hear us say often in reference to that window. But that window is October 15th to December 7th, and that is the one time of the year that you can change your Medicare Advantage plan or that standalone Part D plan, and then it will become effective January 1 of that next year. The Medicare Advantage plans are never subject to any medical underwriting. So it is easy if you do have a Medigap policy and you want to move over to a Medicare Advantage plan, it is easy to move over because there's never medical underwriting. These plans are very similar to a group plan that you maybe were on in the past, or if you're on right now. But again, back to that being network driven, it's more you pay as you go. So, you know, if you have a $0 monthly premium on the plan and you're not using the plan very often, you're not going to be paying much. But then when you go to use your policy, you'll be chipping away at that. There is travel within the US and international. So you always have worldwide emergency and urgent care services on a Medicare Advantage plan. So you would pay the same copay that you would in your hometown if you went to the emergency room as if you were traveling into another state within the US or internationally. And then we just also suggest that don't let your plan ride on autopilot because there are so many changes that happen every year. This year being one of the big years too for many more changes that are coming, but just don't let it ride on autopilot because you never know. There might be something else that's better for you, better fitting for maybe something changed in your health or whatever the situation. But that's why we are here so that you can revisit. So another thing different than the Medigap policies is that these plans offer preventative dental, vision, and hearing. So again, very network driven. So we want to make sure, yep, your dentist participates and that way you get the most of what's built into the plan. So preventative piece is built in. However, sometimes people need a little bit more, right, than just the preventative piece. So there is an option for an additional buy-up. And on the buy-up, it focuses more on really enriching those dental benefits more than the vision. At least that's how it kind of is built at this time. But who knows if something changes at some point. But then you would have another premium if you decided that you needed that enhanced dental and vision. Many of the plans offer the over-the-counter benefit, which is money that goes on a card electronically that you can use in the stores for over-the-counter services, or I'm sorry, for items. Such like vitamins, Band-Aids, toothpaste, maybe you need a new bathroom scale or a knee brace. There's a variety of different products that you can use for that card. And then a lot of the plans have a gym membership built right in, and they're trying to make sure that you as their member stay healthy and active. So there's a lot of different styles of gyms that you can go to. And then just touching on a few other points with those value-added benefits is they sometimes offer meals. So maybe after an inpatient hospital stay and you were returning home, they're going to offer you a certain amount of meals that you can have delivered to your home. That way you can work on getting better and not have to focus on preparing anything. They do offer dietary restrictions as well. And then some of the plans have transportation built right in. Some people might have a hard time getting from home to a doctor's appointment, any of that, but there's transportation built into the plan as well. So a variety of different value-added benefits. Most of the plans, most all of them include the Part D prescription coverage. So that means that you don't have to have an additional standalone Part D plan. It's built right in, so not an additional premium. These plans, just like the standalone on the Medigap side, work the same where they use a preferred or standard or completely out of network pharmacy. So we just look up what pharmacy that you like and make sure too that, hey, maybe you should check out these ones. These are preferred. You're going to get the best dollar amount for your prescriptions here. They do also offer a 90-day mail order. So you can do mail order. A lot of them use Express Scripts. There's a few. CVS Pharmacy. There's a handful of different mail order companies. But that would be a 90 days order. And then, like I said, no additional premiums. There's still the tiers that apply to the drugs that are in the plan. And there might potentially be a deductible that applies as well.
We are actually going to go back a little bit to talk one more area of the Medicare supplement a minute. Just a reminder, with your Medigap plan, there are no networks. Kristen just talked about networks. There is no network for the Medicare supplement plan. As long as a physician or a facility accepts Medicare, they will accept your Medigap. One thing that they do not include is the preventative dental, vision, and hearing that Kristen just discussed that the Advantage plan has. That is not part of a Medigap supplement. It would be an additional policy that you would have to pick up along with your Medigap. You can, on this Medicare supplement, travel anywhere within the United States. Again, as long as a doctor accepts Medicare, they will accept this plan, whether they're in Michigan, Florida, Arizona, California, wherever. These plans do have some limited international coverage, but we do often suggest that folks pick up an additional international travel medical policy for the time that you are going to be out of the country, just for extra peace of mind to cover those costs should you incur them while you're out outside of the United States. And just to reiterate, the Medigap plans can be replaced any time of year. Again, they're going to be subject to that medical underwriting if you do decide to revisit it, but they can be replaced any time of year, even outside of the annual enrollment period. In order to get your prescription drug coverage with one of these plans, you do have to purchase a separate Part D standalone plan, which is renewable annually. And again, is part of what we're reviewing in the next few weeks here with the annual enrollment periods. But you do, so with your Medigap plan, that covers your medical, but you do purchase a separate Part D prescription drug plan that you can renew annually and make sure that your prescriptions are covered. So now let's talk a little bit about some changes that we see coming for Part D. So you may, whether you realize it or not, have heard about something called the Inflation Reduction Act. It actually passed in 2022, but you may recently, if you watched any of the political debates or any of the political ads that have been on TV, they're often talking about capping insulin at $35 or reducing costs of prescriptions for seniors, capping costs for seniors at $2,000, or even letting Medicare negotiate prices. These are all things that were part of the Inflation Reduction Act that passed in 2022. The changes from that act started happening in 2023. That's when the cap on insulin began. And this past year, they had some changes as well, but the major changes are really coming in 2025. Those key changes, first and foremost, they're getting rid of the dreaded donut hole. So that's good news. They're getting rid of that completely. They are going to limit your out-of-pocket costs for your prescription drugs to $2,000. Some of you may not ever hit that, but there's at least 10% of Medicare beneficiaries who have well over that in terms of their medical cost, their prescription costs. So they will be capping that at $2,000. They're also going to make sure that whether you're in a standalone prescription drug plan or on a Medicare Advantage plan, that you have the option to sign up for a prescription payment plan to kind of spread those payments out over the year. And the other thing that's sort of kind of going on behind the scenes with all this is that they're requiring the insurance carriers and the drug manufacturers to cover more of those drug costs. These are the new drug phases that are going to happen in 2025. The first phase is the deductible phase. That's the phase where, if your plan has a deductible, not all do, the maximum deductible they're going to be able to have next year is $590. If you're, not all medications, even within a plan that has a deductible qualify, often they'll say tier 1 and tier 2 don't, the deductible doesn't apply, but if your medication does apply to the deductible, you're gonna pay 100% of that cost until your deductible is met. Then you're gonna jump into the initial coverage phase where you pay either a set dollar amount copay or a co-insurance, which is simply a percentage of your medications cost, as long as they're in the plan formulary. And the plan formulary is just that big list of medications that they cover. If your plan says it covers your medication, then they're gonna keep track of how much you've paid. And once you reach that $2,000 max out of pocket, then your plan is gonna pay for the rest of your prescriptions. Again, and you'll be in what's known as the catastrophic phase. And during that phase, you pay nothing. As long as your medication's on the plan's formulary, it's covered at 100%. It will continue to be covered at 100% through the end of the year, and it'll reset again in January. This is kind of how the plan design is different this current year, 2024, versus next year. So this year, the annual deductible was $545. And when you were in the initial phase, after you've met that deductible, if you have one, you paid either the copay or the co-insurance, and they had a bucket. And they kept putting the money you paid into that bucket and the amount your plan paid into that bucket. And when that bucket got up to $5,030, you were dumped into the donut hole or the coverage gap. During that time, you paid 25% of the cost of your medication, all the way up, and they keep filling that bucket with what you're paying and what the plan's paying, and all the way up until $8,000. And once that $8,000 cap was hit, then you jumped into the catastrophic phase and paid $0. Next year, again, the maximum annual deductible will be $590. The initial phase, once you've met your deductible, same thing, copay or co-insurance, but this time that bucket's only gonna go up to $2,000 of true out-of-pocket costs for you. And once you've reached that, because the coverage gap has been eliminated, you will be in the catastrophic phase and again, pay nothing through the end of the calendar year. Just again, to remind you that cost is shifting. It's shifting from you as the consumer and from Medicare as the plan itself to the insurance carriers. Insurance carriers are going from paying 20% of the cost to 60%. So they will be looking for ways to make up that cost. We mentioned the Medicare prescription payment plan. This is that payment plan that's part of the Inflation Reduction Act, and it simply is going to allow enrollees to opt in and to, instead of paying a lump sum at the pharmacy for your prescriptions, you'll be able to spread it out over the course of the year. This will start in January. And again, it will be available on both standalone plans and on Medicare Advantage plans. It does not reduce your cost. You still owe the same amount of money. It simply lets you break those payments out into monthly payments over the course of, and spread them out over the course of the year. This plan is optional. Not all beneficiaries may want to join. In fact, those who will most likely benefit the most will incur a cost of at least $600 for a single prescription when you go to the pharmacy. You must opt in every year, and you can opt in and out at any point during the year. What will happen is if you opt in and you go to the pharmacy and your prescription's $600, instead of paying the pharmacy $600, if you've opted into the plan, your insurance carrier will take that $600 and divide it over the remaining months of the year. So if you're doing it in January, they'll divide it over the next 11 months of the year. And you will pay your insurance carrier instead of paying the pharmacy for your medication. Keep in mind, this does not cover Part B drugs, or medications not on your plan's formulary. Only medications that are Part D and on your plan's formulary can be put into this payment plan. The thing to think about is that if you have that big $600, maybe one prescription in January, every time you add prescriptions, if you've opted into this plan, the amount that you owe is going to increase, and the number of months available to pay for that is going to be less and less. So each month your payment's going to be more. It's going to change. And towards the end of the year, if you get a big prescription filled, say in September, you only have 3 months to spread that out over the course of the rest of the year. And so you could have some pretty large payments due at the end of the year. So all that to say, this is great, will be great for some people, but it's not going to be for everybody. So what do we expect in 2025? We expect higher premiums on standalone drug plans. So we also expect fewer plan choices. We expect to see that maybe if a carrier had 5 prescription drug plans, maybe they'll only have 3 next year. They're probably going to have stricter formularies. They don't have to cover every drug. And so they may choose to only cover a certain number of drugs in each category. We also expect more drug utilization reviews. What does that mean? They may ask for prior authorization or step therapy. Step therapy is simply if you're on a expensive drug, maybe a tier 4 drug, and there's a tier 2 drug that's supposed to do the same thing. If they're going to make sure that you've tried that tier 2 drug before they will pay for that tier 4 drug. For Advantage plans, we expect maybe higher copays, higher medical deductibles, and maybe a few less of those bells and whistles that Kristen talked about. Maybe less dental, maybe a smaller over-the-counter allowance. But we do expect things to change. So that's all to say, this is the year that you must review your Medicare. It's not going to be the same plan. The plan you're on today may not look identical next year. So you're going to want to take a minute and review it.
All right, so now I want to talk about another type of insurance policy, which is called hospital indemnity. Hospital indemnity is a type of insurance policy that pairs really nicely with someone who has a Medicare Advantage plan. So on a high level of what is hospital indemnity, basically it's a policy that is built to help cover your days when you stay in the hospital. So on a Medicare Advantage plan, the biggest exposure that you have, that could be the highest, the largest cost that you would have to pay upfront would be what your copay might be for an inpatient hospital stay. So these Medicare Advantage plans take those hospital days and break them down. We'll say days 1 through 5, and each day is $300, right? I mean, that's going to be $1,500 if you are there those 5 days. So that's your biggest exposure on an Advantage plan that you have. So this hospital indemnity plan comes in and we sit down together and build it together exactly how you want it to pay out. But then it would basically, it's reimbursing you for those days that you had to pay for. That way you're ultimately avoiding that maximum out of pocket, or if you have to pay the maximum out of pocket, you're getting reimbursed. You're getting that money back. They are meant to be very affordable. So this is a plan to help protect you. There are multiple different riders that you can add to the plan. So if you don't want it, if you want to not just cover hospital stay, you want to also maybe cover, there's a cancer rider or an outpatient facility, like a surgery that you're going to have. There's a skilled nursing facility rider. There's a bunch of different things that you can add onto your plan. And then you would get reimbursed for those items should that happen. So like I mentioned, these are meant to be affordable to give you this protection. The nice thing about these policies is that your rates are locked in. So once you start one of these plans, as long as you continue to pay that monthly premium, you're locked in at wherever you started. There is a guaranteed issue period that a lot of the carriers have now welcomed, and mostly we're seeing that the age range is age 60 to 79 years old. Again, of course, that depends on the carrier, but then that just means that you ultimately get to avoid medical underwriting. So just at a very high level example, if someone was a female, 70 years old, and she wanted to cover 6 days for this policy, she wants to build it, cover at 6 days, paying $400 for each day, that policy would cost her $27 a month. So when you have a really low monthly premium, such as a $0 premium with a Medicare Advantage plan, now you just kind of are adding $27 a month as your premium. It's not too bad. And as long as you continue to pay, you're locked in at that rate, and then you'll get reimbursed should you ever have that hospital stay. So if that's something that you're ever interested in, please let us know. So ultimately, what are some good questions to help you decide? What's the best type of plan for me? What's the most important thing? What do you consider peace of mind? Is it, I have my Medigap policy and I like knowing what I'm going to pay over the course of the year in my monthly premiums. And when I go to use services, I know that there's virtually no out of pocket. Does it make sense to go the other route? Is peace of mind to you maybe, hey, I don't really use my plan very much and I want to do more of a pay as I go? What monthly premium ultimately can you afford, right? You want to make sure that this is sustainable, right? That you can afford to pay your monthly premiums. And then what are your travel plans? I mean, now the Medicare Advantage plans really have started to compete, I guess, if you will, with those Medigap policies because they want to show that they can offer these travel deals too. So, right, you get that worldwide emergency and urgent care. And then if you have the Medigap policy, traveling works really well within the US, but then you could also get a separate travel policy if you're interested, if you're traveling international. A few other questions are, who does your doctor participate with? We, of course, want to make sure that it's within your doctors. And then what type of medical usage are you using? Do you know that you have something coming up soon? All things that we sit down and talk with our clients about. Do you have a rainy day savings fund? This kind of goes back to that hospital indemnity plan. That could be an extra little coverage to help you should you have to pay that maximum out of pocket for the year, right? So ultimately, it really is going to depend on what is the most important thing to you. Don't forget, there is the 12-month trial, right? That does exist. So if you have your Medigap policy and you're interested in trying out for 12 months, 1 year, the Medicare Advantage plan, you do have a one-time trial, right? Where you can come over to that policy, try it out. And if you decide, nope, I don't like this, I want to go back to what I had before with the Medigap, you can go back with being able to avoid the medical underwriting questions as long as you're within that 12-month window. Medicare Advantage plans, they never require medical underwriting, so they're easier, of course, to always move to. And then the replacement of a Medigap policy, we can revisit that again now moving into January 1 of 2025, simply because we're about to reach that really busy season where we'll be focusing on the standalone Part D and the Medicare Advantage plan revisits. And then just to keep in mind too, those Medigap policies that can be reviewed at any time of the year, then you're just subject to that medical underwriting approval. And a final little notice, are you receiving those pesky calls all the time? The call centers. We just want you to be aware of and know that there actually is a national do not call registry. So you can either you call them or you can do it online, and we have that information. So if you want to reach out to us, we can definitely send you that. But to ultimately try to avoid having all of these pesky calls. And if you're still getting calls after you've done that, you can also file a complaint. So just a quick summary. Do not forget that you will be receiving, if you haven't already at this point of the year, your annual notice of change. They're going to send you on that standalone Part D or on your Medicare Advantage plan, your annual notice of change. Take a peek at it because maybe it will ultimately determine that you're good and you didn't want to make a change for this coming year. Or it might flag you to say, all right, I need to get in and see my agent. The upcoming annual election period again is October 15 to December 7, and then your new plan will be effective January 1st. Of course, like I mentioned, if you have your Medigap policy, we're going to at that time review your Part D and then also the Medicare Advantage plan. We are asking in advance for our clients prescriptions, doctor list, and a scope of appointment form, just so that way we are on top of the game. The scope of appointment form, we have to have 48 hours prior to your appointment. That is a rule. by CMS, so we can't avoid that one. But we also need your prescription list so that we can run the Part D analysis, and then doctors if you have a Medicare Advantage plan. So if you would like to have an appointment with us, please give us a call. We will do we will do a phone appointment, a Zoom appointment, in person, whatever is needed. We are going to be encouraging a few more phone appointments this year, simply because this is going to be a big year for people to revisit their plans. And if it means, hey, we can just talk through things over the phone and a change isn't necessary, then we might see if you're willing to do that. All right, so thank you so much for watching our webinar, and we hope to see you soon.